Hello again, Msonda Mulundu Chipampata is my name, and I've been blogging about my bipolar affiliation. I'm not calling it a disorder anymore because I've realized now that it's not actually a disorder, it's just something that you have that other people don't have. And in my case, it started only 17 years ago, and it started triggered by certain events that happened in my life. But what I want to focus on right now is acute psychosis, which is the state that you find yourself in when you're having a relapse. I want to speak about this because from the time it started happening back in Austin, Texas, I would go through a state that most people would not understand. As you're looking at somebody, you might be thinking the person is with you, but there's so much going on in the person's mind that it's not easy to describe. In America, I remember I went through a state where I was typically hearing things. When I'd make a phone call, I'd be able to say certain things that people wouldn't understand. Or if somebody, for instance, tells me that at that time I was seeing somebody, they were driving past a place called Hill, which is a shopping mall, and they were telling me about how they were passing by, and I would say I would correct them by saying something else. You see, basically telling them where the actual location was. How I knew that, how that happened, I don't know, but that obviously freaked them out because they were trying to lie to me at the time. But anyway, that's not the focus of this. Acute psychosis basically is what happens to us people who experience bipolar. Because until now, I always thought I was alone in this. I thought nobody else had suffered from this until I actually started studying it. So I'm so happy to actually find that I've got references to it, and there's even names for these things. So when I go into acute psychosis, there's a lot of things happening simultaneously in my mind. Number one, I could probably talk about sounds. That's where most people think that we hear voices. It's not that we hear voices. It's like the things practically playing in our minds, part of our lives, part of our imaginations, things that we've seen before. You know, it's a combination of so many things. And to be honest with you, I'm no longer looking at this thing as a defect. I'm actually looking at this thing as something that most people don't even get to experience. It's just that it comes with so much vigor that it's difficult for you to contain yourself. It's difficult for you to even entertain people around you, because the way you're looking, you look stressed on the face. You don't really look normal. People don't take you seriously, and the first thing people want to do is take you to the hospital. So for the first time in my life, I can say that I'm actually not cursed by having this thing. I'm actually blessed by having it. And I've heard people tell me that before, especially here in South Africa. Most people just say that it's a calling, or it's got something to do with importance. For the first time, I'm actually associating it to something more important than just a disease. Yes, a lot of people don't understand it, and a lot of us don't know what to do with it. But if there were more people out there, like my inspiration right now, who is Sean Blackwell, I would encourage them to probably listen to Sean Blackwell, because he's experiencing exactly the same thing. He's been experiencing it from 1996. He's found a way to live with it. He's managed to get off the medication, and he's helping other people. So I think I want to give myself now the opportunity and the audience to say, I want to help other people that are in the same situation as me to live with it. And like I mentioned before, I've got a friend in Kitwe called Nelly, and she's also managed to, defeat this whole thing, and it doesn't bother her anymore. Her mother helped her a lot in getting out of this. So anyway, I just wanted to speak about acute psychosis as something that people should understand. Whenever you see anybody that's got bipolar, remember those two words, acute psychosis. That's the phrase. That's my catchphrase for the day. That's my catchphrase for the month. That's my catchphrase for the year. I'm happy to know now that there's clearly something that can be done about this, and I'm very, very happy to hear it. Thank you very, very much for your time, and may you have a good day. Thank you.